Why do you think so many people think Medicare covers long-term care?
Because they don't understand what Medicare does. And part of that is we haven't done very good public education. Because I don't think public officials really understand what Medicare does, so they mix the two up when they talk about it. Because we talk about Medicare as health insurance for the elderly, and the assumption is that the elderly need long-term care, so why isn't that part of health insurance? We just obfuscate the entire
So what
system.
is Medicare?
So Medicare is the health insurance program for elderly. Medicare is a health insurance program that we all contribute to, both as a social insurance program, which is universal health care, right? It is a single payer system, right? It is a universal health care, a single payer system, which allows people over 65 to have access to some basic health care, right? That has some significant costs associated with it for the average older person, that only covers about half of their healthcare costs. But having said that, that's half of the healthcare costs that are actually covered. And the result of that is that we have people living longer lives than they did before. I mean, these things really do have positive consequences in people's lives.
That's right. Can you talk about the relationship between long-term care and health care?
The fact is that people do have longer lives as a result of access to health care.
Right.
And part of having those longer lives is that they have to be cared for one way or another in those longer lives. So you are able to, you're able to make sure that someone's heart condition is controlled with healthcare, with medicine that's paid for, cardiologist that's paid for in large measure by Medicare. But there are all the other things that have to happen in order to maintain that particular person.
Right.
Right? Somebody has got to help them eat
Healthy.
At some point, a person's activities of daily living become restricted, and as a result, somebody does have to help people do things like get in and out of bed.
So healthcare professionals and institutions actually need long-term care and long-term caregivers. Right. There's an interdependence there.
Yes.
And also a difference.
Right. There is total interdependence there, and also a difference. The doctor may see, if it's a good doctor, she or he may get 15 minutes with you. When, if it's a good doctor, she or he will spend that time explaining what they're doing, what they need to do to help you with your health. And they may do some care at the same time. But the care that goes on beyond that is not done by a doctor. It is done by a family member. It is done by a paid caregiver. It is done by somebody whose contribution to your well-being may be, and any doc that's watching this is going to get angry about this, but maybe just as or more important than some of the things doctors are doing.
Right.
They couldn't do their jobs without that intervention.
A lot of people say that good caregiving is the best prevention.
It's absolutely the best prevention.